Live now. Right. Hi, Facebook. You are joining us this morning for Silver Linings Programming, and today is one of our community partners programs. So we have Tammy Jacobs here with us from Iowa State University Extension and Outreach, and Tammy is the Hotlines coordinator. So she's going to be talking to us about Iowa Concern Hotline. And if you have any questions, feel free to put them in the chat. And if you're on Facebook, we have somebody that will make sure that those questions in the chat get back to us. Thank you so much for joining us today, Tammy.
Thanks for inviting me. This is pretty exciting. My first time ever doing Facebook Live. So I'm pretty excited to be here and share with you all information about the Iowa Concern Hotline and how we're a part of the program and how we can help you all.
Great. Well, first off, I think kind of a good segue is we have shared Iowa Concern Hotline a lot with our COVID recovery Iowa community because Iowa Concern Hotline plays a role in COVID recovery. Would you like to briefly explain how that works?
Absolutely. So back in the beginning of COVID Recovery Iowa, we were asked to be a part of the grant in one of the hotlines. Iowa Concern Hotline has been around for a couple of years. We've been around since 1985, kind of evolved throughout the years. And for many years, whenever there's a disaster or a situation in the state where they need a centralized number, Iowa Concern is one of the hotlines that's utilized in order to help Iowans to have their needs met, resources found, and just be a part of a lot of the outreach programs that are out there. So we've been a part of this program as the hotline staff, and we have outreach staff on our staff as well through the program.
Great. Well, and would you like to give a little bit of a brief overview kind of what Iowa Concern Line is?
Absolutely. So when somebody calls the Iowa Concern Hotline, and actually there's several ways that you can get in touch with Iowa Concern. We do have our toll-free number, which is 1-800-447-1985. We also have email and experts. We have live chat, and we have texting available, and texting is the same number that I just gave. The services and resources that we provide at the hotline are pretty valuable information. First of all, if somebody just needs somebody to talk to, that's what our staff are going to do, is just listen to the needs of the caller, listen to what's going on. And from there, if they need something beyond that, we're going to be able to find a plethora of resources in our database. So like if that person's needing housing assistance or they're needing rental assistance or food assistance, we're going to be able to provide them information on their local community of what's out there, what's available for them. The other thing that we also offer is financial education through our partnerships at Extension and Outreach. If somebody's needing some financial education, they're needing to look at revamping their budgets. You know, COVID has impacted a lot of us financially, and we've had a change in our budgets. So we've had to do some recalculating and refiguring of how things are working and where our monies go to. So we're partnering with the Human Sciences Extension and Outreach financial education staff to do one-on-one coaching, budgeting, and they're just there to help out with a lot of different avenues. We also have an attorney on Iowa Concern Hotline, and that attorney's there to help out with legal education. So if somebody's having a situation with unemployment, if they're having a situation with their landlord, they can visit with our attorney to find out and get educated about what their legal rights are and how they can move forward in that situation. And then we also have information and referral. Like I said earlier, as we're talking to folks, if we find that they have a certain need, then we're able to provide those resources for referral and information. But a lot of what we're doing on the project is we're really providing a lot of stress counseling. Just talking to individuals, providing them with tips and tricks and tools in their tool belt to help them as they're going through the struggles of how COVID has impacted each person throughout this time.
It sounds like it sounds like there's a lot of assistance that you guys are able to provide
Absolutely.
Iowans.
Yeah.
Um, and, you know, kind of, so you talked about resource referral, and one thing I want to note for anybody joining us on Facebook is we had talked last week about how to navigate 211, and Tammy, Iowa Concern Line plays a part in 211 as well, right? Would you like to
Yeah.
tell us a little bit about that?
Yeah, absolutely. So 211 is a partnership in the state, and there's 5 different agencies that take that role and responsibility of helping Iowans through 211 for the state. And we actually navigate and help out individuals throughout the entire state, but we primarily work with 25 counties in the state, and then the different counties are answered by the other call centers as well. We all have a partnership in our database, so we're able to see resources from all the different counties. And that way, if somebody calls us in, we can help provide them with those resources rather than send them on to somebody else and send them on to somebody else. So we want to try to alleviate having to forward calls on. We want to be able to provide them with that information as we can find it and what's available for them rather than sending them on to other agencies to find out information.
And so Tammy, you had kind of mentioned all of the different areas that that Iowa Concern Line helps with, and so it sounds like there are a lot of people involved, kind of experts involved when it comes to legal or financial information. Can you tell us a bit about just when people call, who's behind the phones? What entities are part of Iowa Concern?
Absolutely. So currently, because of this grant, we actually have some virtual counselors or outreach staff who are part of the program. So we've ramped up and we've increased the number of staff who answer the calls. All of the staff who answer the calls are going to be trained professionals, and they either have a 4-year degree in the human sciences field, such as counseling, psychology, social work, or they have the equivalency between education and work experience. All of the staff who've gone through specialized training for answering calls, they've gone through specialized training with the state on outreach counseling. Through the program, we do have 4 staff who do outreach counseling. So they can go out and work with individuals. They can work with people via Zoom, email, phone calls, whatever is the most convenient for them to be able to work. And 2 of those staff also answer the hotlines. So they kind of have a dual role in doing outreach work and answering the hotlines. Currently, I believe I have 8 to 10 staff who regularly answer the calls. So the staff are well trained and well versed in helping individuals. The one thing that we don't do is counseling. We don't do suicide, suicide. We're not suicide experts. We're going to get people who have those situations connected with those professionals who are trained in order to help them. But we're going to work with them on de-stressing them to get them to a situation where they're safe before we get them connected to those resources. So pretty much whatever the caller calls in on, we're going to be able to figure out what's going on, how to help them, and if we need to send them to other resources for more assistance, then we're going to get that need met as well.
And so one thing I've noticed is that with COVID, it just seems like the pandemic has really affected a lot of different areas of people's lives. And often, even outside of the pandemic, it seems like sometimes we go through these big times in our life where a lot of areas of our life are touched or affected. If I'm somebody who has kind of a lot of stuff going on and don't know where to start, could we call you guys and just?
Yep, absolutely. In fact, the hotlines would be the best place to start, because with like you said, even with the pandemic or without the pandemic, people have different experiences
Gotcha.
going on in their lives. So we just want to be able to help them to figure out the situation, help walk them through what's going on. And, a lot of times that person just needs to talk to somebody. They don't know who to talk to, they don't know where to go. And we can help that initial phase of talking to that person. And then if they do need further resources, then we can help them navigate the different resources. There's a lot of different resources out there. And if you don't know what some of them are, if you don't know where to go, it can be really a lot of work. It can be overwhelming to try to figure out what the different resources are. So that's one of the things that our staff can do, is to really help them walk through what are those resources, what are the tools that they need to be successful. And then we can help them find those tools and develop their own tools. A lot of people really have gone through stressful situations before, so they have those tools already built inside of them. But when you're going through a stressful situation, you forget, you get stressed out, you don't think about what those tools were. So one thing that our staff do is they help to pull those tips and self-care things that people already have in their system, but they just forget how to find those. So that's one of the big things that our staff try to do as well.
That's really nice, because that leaves, if I call in and you're helping me do that, that leaves me feeling empowered.
Mm-hmm. Absolutely. And that's the one thing that we want to help callers realize is we don't want them to be dependent on us or any other entity or agency. We want to empower them so that they can grow and they can really develop, and that they can have their own self-impact in helping themselves, rather than completely relying on other people to have that impact. So we do really like to empower people and give them those tips and tricks and tools that really they probably already have, and they just need help to really refine those things that they have already developed in their lives.
So Tammy, can you tell us a little bit too about who can access the concern line, and just talk about accessibility?
Absolutely. So our hotline is open 24 hours a day, 7 days a week. So whenever you call, there's always going to be somebody that's going to answer the hotline. We do have language line interpreters available. We do have a couple staff who speak Spanish. So if we get callers who speak Spanish and those staff are available, we're going to have those staff work with those callers. Otherwise, we do work with language line interpreters, and we have access to over 150 languages. So pretty much we can help any person who calls based on their language availability. We also have email capability. So if people email us, even if they speak a different language, we can actually access language line to help us interpret what those say. So as far as accessibility, we can meet anybody with any kind of special needs. We have TYY available, so we can pretty much meet anybody with any kind of specialized needs in order to help get their needs met.
That's wonderful. So you guys really are available to any Iowan.
We are. And in fact, the Iowa Concern phone number, the nice thing is it's not just limited by the boundaries of the state of Iowa. Anybody in the United States can actually reach out to the Iowa Concern hotline. So as people relocate to different areas, they may still know the Iowa Concern number and still reach out to us as they have moved on in their pathways as well.
Oh, that's great to know. That's great. There have been a few instances at COVID Recovery Iowa where I know that we've had folks from out of state contact us, and that's just great to know that Iowa Concern Line is there for those people as well.
Absolutely.
I was wondering if maybe we could share the website just to let everybody know what it looks like when you go visit.
Absolutely.
Let's see. And if you are just joining us at this point in our presentation, just a little recap, we have Tammy Jacobs here, who is the Hotlines coordinator for Iowa State University Extension and Outreach. And Tammy is talking about the Iowa Concern Hotline and what kinds of services are available to Iowans 24/7, totally free. And I don't know if we mentioned this part, Tammy, but it is also totally confidential as well.
Absolutely. Yep.
Oops.
The only time that we would take any kind of personal information is if we need to reach back out to you. We may ask for a phone number. One of the things that we do like to do is ask for your zip code. And the reason why we like to ask for your zip code is that way, if we need to look up resources, then we have that information available pretty quickly and easily to be able to refer you to some services that might be available. So this is our website. Go ahead, Ash, sorry.
You know what, I'll ask when we're done with the website.
Okay.
Okay.
So pretty much it goes through some of those areas that I talked about earlier that were available to help: the legal, the financial, the stress, crisis and disaster. And if you click on each of those, it's just going to give you some information about some referrals resources that might be available as well. There's also where you can email an expert located right on this page. And there's also live help, which is our live chat system. So it's kind of an instantaneous way to connect with us, to be able to reach out and to get the assistance that you need.
That's great. And it looks like the website is just very straightforward, as you had mentioned, with all the topics off to the left and then all of these avenues to connect off to the right.
Correct.
Let's see, I'm going to stop sharing here. And then the question I had was, you mentioned zip codes.
Mm-hmm.
I would think, are resources pretty different for folks maybe who live in one area of a state or another?
A lot of it depends more on the population size. Pretty much a lot of the resources are found throughout the entire state, but some with higher populations, like if you look at Polk County, there may be some larger individual businesses that might be able to provide some of the financial assistance. But pretty much we're going to find a plethora of resources throughout the state. The one thing that we do know is lacking is behavioral health resources, especially in the rural areas, which this is where I like to put my plug in for. You know, COVID has really shown us a lot of, it's not been fun, it's not been good, but the one thing that COVID has done is has really increased that opportunity for virtual telehealth, which has been a great thing when we're talking about those rural communities that generally lack services. It's a great way to get those services more into the hands of rural folks because they don't have to drive an hour, 2 hours to get to a counseling appointment. You know, many medical doctors are doing appointments virtually as well. So it's really increasing the availability for those services to those who are more in the rural area than previously has been known.
That's great. That would be really nice if that continued, you know, post pandemic.
Absolutely.
Let's see. So, Tammy, are there any other big points that you would like to hit about Iowa Concern Line?
You know, I think I've hit a lot of them. The one thing that I haven't really hit on is a new part of the of COVID Recovery Iowa that Iowa Concern staff are a part of, and that's actually doing some stress debriefing with different agencies and businesses. Our staff have been, certain staff have been trained in order to go out and meet the needs of businesses and individual organizations. You know, when we're talking about COVID and it's almost been 2 years, so it's been a long time that we have really been impacted by COVID. People are really now starting to experience a lot of the stress. So but they don't have a means to talk to it, especially when we're talking about in large groups or businesses. So we're actually working with communities and going out and working with them on just allowing them to have that time to talk and to share and to really open about how their experiences, their feelings are been through dealing with COVID. So that's the new thing that we're really starting to press and work on there. But you know, our hotline is there for individuals who just want to call and talk. And I just want to stress that we're there 24 hours a day, 7 days a week, to help individuals out, to help them deal with a stressful situation, to just listen, to talk, and then to point them to resources that they might need. But like I said, they might just need that listening ear of somebody to talk to because they haven't had that opportunity through this time.
And Tammy, we have a question that says, how can Iowa Concern Line help those impacted by the recent derecho?
So like the situation that just occurred with the storms or the derecho from 2020? So I'll kind of touch base on both of those. So the recent storms that hit, the governor has declared it's over 50 counties now to be individual assistance programs. So if folks who've been impacted by that, call the Iowa Concern Hotline. We can guide you and direct you to what qualifications are needed to meet those expectations for the program, because there are certain limitations to the individual assistance program that are limited by the state resources. But if people want to call the Iowa Concern Hotline, we can get them connected with those entities who are providing that assistance for the recent disasters, and get them signed up for assistance if they meet that, or get them connected with some volunteer entities if they don't meet the criteria for that program. One of the things that I'm also involved in is a program called the Disaster Human Resource Council, Iowa Disaster Human Resource Council. And one of the things that we do is we help to meet unmet needs. So if there's needs that are unmet by disasters, then our group really looks at that to try to see what can be fulfilled with those unmet needs. Is there entities of volunteers that can go out and help out, financial assistance through some grants? So we try to help out in that regards. As far as the derecho that hit in 2020, a lot of the resources are ended for that because it has met that time period. But I know there's still some volunteer entities that are still working at trying to do some of the cleanup for that. So it just depends on what the needs are. So if you contact the Iowa Concern Hotline for either one of those disasters, then we can see what is available at this time for those. A lot of times after an individual state assistance program has been declared by the governor, she does an application to the president to get a presidential declaration. And if a presidential declaration has been received and approved, then that's when a little bit more assistance comes into play. But at this point, it's just the individual state assistance from the governor at this time.
I think that brings up a really good point, which is that with disasters, the assistance available changes. And
Yes.
And so Iowa Concern, I would assume, is very up to date on what resources are available and,
Yep. Absolutely. So as soon as there's any kind of governmental allocation for individual assistance, that information is put into our database. It's also shared with all of our staff as far as what's out there, what the process is, and how individuals get signed up for those services. And then if it turns into a presidential declaration, then as soon as that information is out there, we know the resources and services that are going to be able to meet the needs of Iowans who have been impacted.
Well, that's very helpful, because I know that resources change kind of frequently. So it's nice to have an entity that's very current on that. And
Yep.
So if you are with us on Facebook and you have any more questions, please feel free to put those in the comments right now. Tammy, I like to do this thing at the end where I try and give my takeaway as an audience member, and then you hop in and tell me if I missed something or if I got something wrong, or if you have any more to add. So we're here with Tammy Jacobs. She's the Hotlines coordinator for Iowa State University Extension and Outreach, talking about Iowa Concern Hotline, which is a 24/7 free confidential resource for Iowans, which is accessible through phone, through live chat. You can email an expert. You can see phone, live chat, email, text. Am I missing one?
Nope, but you got them all.
Okay. Like, are there any more ways to contact? And you all have a bunch of trained staff on hand who are available for stress counseling, for resource navigation and referral. For you have an attorney on hand to help with maybe legal questions somebody may have. And through the Extension Human Services program, there are financial counselors on hand who can give finance tips or budgeting help. Super accessible, available to people inside and outside Iowa. Language interpretation is available. Spanish speaking staff is on hand. TTY is available. And let's see, and you guys are up to date on crisis and disaster resources as well. So essentially, if anybody is looking for personal support or help finding resources in their community, Iowa State or Iowa Concern Line is a really good place to just start, because you guys are plugged into all of it, right?
Absolutely, and I think you nailed everything pretty much on the head. The only thing I just want to stress is our attorneys that we have on staff provide that legal education. So they're not going to give you advice. They're not going to represent callers or inquiries, but they're going to provide them with education about the law and steps that they can take in order to look at things.
Well, that's great. That's a very helpful resource. And if you're on Facebook, we will make sure that in the comments, there's access to the website, there's access to the phone number. Tammy, is there anything else that you think we should cover today?
You know, the last thing I just like to end with is thank you guys for coming on to this. Again, this was my first time doing Facebook Live. It was pretty easy to do. But like Ash said, the hotline is there 24/7. And I'm just going to put a plug in for that number again. It's 1-800-447-1985.
Thank you so much, Tammy.
Thank you for asking me to be on this.
Of course.